Enhanced Milieu teaching, also known as EMT, is an effective language intervention for toddlers and preschoolers with language impairments. It is a naturalistic, conversation-based intervention that uses a child's interests and language initiations as opportunities to model language and prompt language in everyday context. EMT is used with children diagnosed with intellectual disability, ID, autism, language impairments, cleft palate, and Down syndrome. EMT is a set of language tools that help us to facilitate a child's communication growth. The use of EMT tools increase a child's language targets, for example, increase vocabulary, early syntax, and even moderately complex syntax. They increase a child's frequency of communication. They result in generalization across settings, people, and language concepts. And lastly, EMT tools result in the maintenance of newly learned targets. First tool, setting up an interactive context. You do this to enhance opportunities for communication. You put yourself at eye level with the child and you do whatever the child is doing. Follow the child's lead and avoid giving directions. Avoid questions and let the child initiate the communication. Choose toys that are interesting and engaging and put toys away that aren't being used. If you don't want the child to do something, then give him another option. Second tool, responsive interaction. This means you're responding to the child's communication. Be sure to notice and respond to all communication, since this teaches the child that their communication is important to you. By acknowledging all communication and communicative attempts, you reinforce the child for communicating. Remember, the more the child communicates, the more practice he receives, and the easier the communication becomes. Also, utilize taking and balancing verbal turns. Taking turns allows the child more opportunities to communicate, and taking turns teaches the child how to have a conversation. Waiting signals to the child that it is his turn to communicate. Third tool, modeling and expanding play. Why do we teach play? Because more play, more action, and more toys all equal more opportunities for language learning. Linking words with engaging activities maximizes opportunities for teaching language. And expanding play activities and objects allows us to use, model, and teach more language. How do you model new play actions? By continuing to follow the child's lead. Do what the child does and try to add a different action or object. Set a new toy object in sight or model a new action, and wait to see if the child shows interest. If the child shows interest, model a new play action with the object. As always, follow the child's lead, and if he is not interested, try again later with a different object or action. Fourth tool, Modeling communication targets. You do this by using language that teaches. This is referred to as target talk. And you do it by expanding your child's utterances, aka expansions. The goal here is to increase the rate at which the child communicates. Also, to increase the diversity of his communication and to increase the child's independence, which means his spontaneous communication increases and his dependence on your cues decreases. We model language because children learn language through modeling. We know that contingent modeling that is in response to the child's communication is the most powerful form of modeling. We also know that simplifying language to match the child's language targets helps him learn language more quickly. Modeling makes it easier for the child to imitate and understand language. An expansion is adding more words to a child's communication. The most powerful expansion includes one of the child's communication targets. Expansions immediately connect a child's communication to additional new communication. The more the child hears and practices language that is more complex, the better his language skills become. When you give a child a little more language than he gives you, he hears more about the topic in which he is interested. Expansions help the child learn new vocabulary and talk in more complex sentences. Fifth tool, environmental arrangement strategies. This means you are using nonverbal tasks to elicit communication. An example is using time delay strategies. Time delay strategies, TD strategies, are nonverbal strategies that encourage the child to communicate with you. First strategy is called inadequate portions, which means you provide small or inadequate portions of preferred materials to the child. Second strategy is assistance, creating situations in which the child needs the adult's help. A third strategy is called waiting with routine, and that is setting up a routine in which the child expects certain actions and then you wait before doing the expected action again. A fourth strategy is waiting with cue, which means you are using associated objects, i.e. shoe to foot, and then waiting before completing the expected action. A fifth and final strategy is called choice making, which means you're holding up two objects and waiting for the child to communicate about which item he wants. We use TD strategies in order to provide the child with more opportunities to practice communicating. It increases the child's rate of communication. We also use TD strategies to provide the adult with more opportunities to teach new language by responding and by expanding the child's communication. The sixth and final EMT tool is called Milieu teaching procedures. This involves prompting the child's communication targets and providing functional reinforcement. An adult prompt is a signal to the child to do or say something. There are 4 types of prompts with different levels of adult support. First prompt is called time delay. It means waiting for 5 seconds. And this is an overt nonverbal cue for the child to use language. The adult uses an expectant look and waits for the child to verbalize before performing the expected action or giving the child the desired object. This offers the least language support. Second prompt is called an open prompt. The adult gives an open prompt which has no single correct answer. For example, what do you want? Another type of open prompt is one that offers a little more support by verbally cueing the child to verbalize his or her request. Tell me what you want. The third type of prompt is called choice prompt. This is where the adult uses a choice prompt that has no single correct answer. For example, dog eats or dog drinks. This offers more support by including the answer in the question. The final type of prompt is a say prompt. You say and then you fill in the blank. This offers the most adult support as it tells the child exactly what to say. Thank you for your attention. I hope you have found this presentation on Enhanced Milieu Teaching, EMT, informative and helpful.